Hello and welcome to Dr. Z's Health Academy. In this video, I'm going to talk about eye injections. And the first question people have when they're told that they need an eye injection is this going to hurt? And the truth is that if done properly, eye injections usually do not hurt. People tell me that they can be a little bit uncomfortable, they can be irritating, they can be a nuisance, but typically are not very painful experiences. Your doctor will usually numb your eye, then clean your eye, then use a device to hold your eyelid open, perform the injection, which only takes a few seconds, and then remove the device that holds your eyelids open, and then you're done. Most of the time, if proper anesthetic is used, eye injections are not painful. So that's great. Now your next question is, well, why do I need to have an eye injection? Well, eye injections are used for a lot of different eye diseases, most commonly AMD or macular degeneration, diabetes, and retinal vein occlusions. AMD, diabetes, and retinal vein occlusions are some of the most common conditions for which your eye doctor might use an eye injection. And there are some other conditions as well, but these are the most common ones. Now that you know why we do eye injections, your next question might be, well, what are the complications or the risks of eye injections? And there are two main sort of serious risks, and that includes infection and retinal detachment. There are some other potential complications such as scratched cornea, bleeding on the surface of the eye, bleeding inside the eye, high eye pressure right after the injection. But those are more minor compared to these two serious ones, which are infection and retinal detachment. And these occur usually less than 1 in 1,000. In fact, some studies suggest that the rate of infection is 1 in 1,500 or even as low as 1 in 2,000. But just know that getting an infection or retinal detachment, even though it is a very serious complication, is a very rare complication. There are also some complications that can happen that are specific to the medication that's being injected. For example, if you're getting an injection of a steroid medication, then two of the main complications from that include cataract formation and high eye pressure. Steroids are commonly given for inflammation in the eye, and I'll put in here steroid. So if you're getting a steroid injection, you have to be mindful and aware that it could lead to the formation of cataracts or high eye pressure. Usually these things are treatable. Other potential complications from a medication itself is high blood pressure, or stroke or other cardiovascular events. And these we may see an elevated risk of from medications like Avastin, Lucentis, or Eylea, and these are drugs used most commonly to treat age-related macular degeneration, or AMD. And the information that these drugs can perhaps lead to an increased risk of high blood pressure or other cardiovascular events such as stroke really comes from data when Avastin, this first drug here, was used as chemotherapy when it was given in a much, much higher dose in a person's veins. Typically, at the low dose that we use inside the eye, we do not see high rates of high blood pressure or cardiovascular complications, but you should be aware that these may occur and you should talk to your doctor about them. So to summarize, eye injections are used for many patients for many different eye conditions, including macular degeneration, diabetes, and retinal vein occlusions. They typically do not hurt, and there are some rare complications that occur from eye injections, but for the most part, the benefits outweigh the risks, and you should talk to your doctor about your specific condition and if an eye injection might help your eye condition.